Run, 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 run. Run for grace through every mile. Scream for life with every smile. Together we stand, strong and true. Run for grace, we'll see it through. Run, 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 run. Run for grace through every mile. In the morning light, we lace up our shoes, running with hope in a world we choose. For every heartbeat, for every life, we run for grace and scream for life. Run, 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 run. Run for grace through every mile. Scream for life with every smile. Together we stand, strong and true. Run for grace, we'll see it through. With every step, we break the chains, lighting the path through joy and pain. For those we love, for those we have lost, we run for grace and scream for life. Run, 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 run. Run for grace through every mile. Scream for life with every smile. Together we stand. Run, 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 run. Run for grace through every mile. Run, 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 run. Run for grace through every mile. Run, 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 run. Run for grace through every.
Good evening, everyone. Welcome to the Global Breast Cancer Run webinar series. This evening, we are honored to have Dr. Priyadarshini join us on the most important topic of hair and healing. Thank you very much, madam, for your valuable time to join us this evening. And hair and healing, reclaiming your identity post-chemotherapy. I request Dr. Priyadarshini to please lead us on this session. Thank you, madam. Over to you.
Thank you so much, Dr. Vipin. I will be presenting something to just show us what we are as doctors can, take care of and what all things we can do for the patients. So let me just start the presentation. उससे थोड़ा सुनाई दे रहा है ना विंडो करो So, what we are going to talk about mostly is about how the hair loss happens because of the chemotherapeutic agents. What things are available at the moment which can, slow down the loss or decrease the loss or completely prevent it. Other things such as what can be done after the chemotherapy is done, and few things which we can take care of before the chemotherapy has started as well, hair wise. So first talking about, of course, we all know that just as soon as we hear the diagnosis, about having cancer, be it for ourselves or if someone else that we love and know, it kinds of bring a lot of trepidation for us. But yes, we have seen, and I'm sure all of us, we have someone that we know, patients also, who have survived this very well, and of course, the resilience is something which stands really clear and apart. Now, what I would like to talk about is, as hair doctors, what all things we are actually bringing to the table, or what we have seen has helped over the years. uh, in this chemotherapy induced alopecia. So first, let's talk about how and it happens. So this is actually called as anagen effluvium. So anagen effluvium basically means anagen is the growth phase of the hair. So around 80 to 90% of the hair follicles, they are always in that growth phase, and around remaining 20% or so will be in the shedding or the falling phase. So now, whenever there is the growth or metabolically very hyper state that the hair follicles are going through, they're rapidly going through division. So whenever chemotherapeutic drugs are going inside the body, what happens is when it is trying to kill those cancer cells, it also identifies those rapidly metabolizing hair follicles as something which is not normal. So what these drugs essentially do, they also try to, attack those hair follicles and the hair follicle keratinocytes, because of which the hair root basically goes to a resting phase and the hair starts falling off. So that is why the word or the terminology comes from. Anagen is the rapid growth phase of the hair, and effluvium essentially means, to let out, to fall out, basically. So what we have seen is this typically starts from around 2 to 4 weeks of when the chemotherapy starts, and it may affect to about 65% of people undergoing chemotherapy. And it may affect not just the scalp hair, it can affect facial hair also, that is beard, mustache. It can affect your eyebrows, eyelashes, and even armpit hair. Next, so again, here also there is a diagram which basically shows what the hair cycle looks like. As I had already told you, the anagen phase is the highly active phase where the growth of hair is happening. The stem cells underneath are rapidly multiplying and giving the hair shaft its whole substance to grow in length out. Then there is a catagen phase which slowly dies down, where the hair is, going slowly to a resting phase. Telogen phase is where the hair basically comes out of the hair roots, and then slowly a new anagen phase, or the stem cells again starts to metabolize to give out a new hair, which slowly grows in length over time. Now, because this is a very active stage, chemotherapy or radiation or even sometimes certain infections specifically target those actively metabol cells during the anagen phase or the growth phase of the hair cycles. Now, here are a few things that we can take care before we know that we are going through a chemotherapy session. So first, of course, if someone is not using, any kind of harsh chemicals like bleaching, coloring, etc., then definitely the caliber of hair, the strength of the hair is maintained from before the chemotherapy. Perming of hair, which again uses a lot of chemical and a lot of heat, again can weaken the hair shaft. So all these things, if are avoided, they are really good. So if we are more active about the general hair health before the chemotherapy, then yes, chances of recovery becomes better. So these points that we have here is avoiding hair dryers, using very hot blow dryers, other heating devices like hot rollers and curling procedures like the perming we had already spoken about. All these things, I would say, if someone has not done or doing very sparingly, then of course the reversibility of the hair loss or hair fall after the chemotherapy is decreased. Now, coming to the length of hair, we have often seen that before the chemotherapy starts, people tend to shave their hair. That is not because, again, that the hair will come out stronger. That is not true. But it is more helpful, I would say, because when the longer hair tends to fall, then it becomes more heartbreaking. So if we keep the hair short before the therapy, I think the fall is not something which is very visible, and it is easier for the patients to tackle with it. Plus, Small hair tends to give you that more volume and it looks much better, I would say. Um, Transition from short hairs to baldness is less horrifying than having it with long hairs. Some people, of course, choose to completely shave off their scalp as well. Now, coming to few things that we can do after the chemo, as we had already discussed, that after almost around 2 to 4 weeks is when the hair loss typically, starts happening, or the hair shedding typically starts to happen. So at that point in time, after the hair fall has started already, good things to take care of is good scalp health. By good scalp health, I mean doing a good rinsing or good shampoo of the scalp using something gentler, not something which is very harsh, is always very important. Using a softer brush. Some brush tends to have very pointed bristles. Those that shouldn't be the case. Something which is little softer on the skin and much more gentle is always preferred, because the scalp tends to become a little bit inflamed during those time. So you want something which is soothing and not very rough on your scalp. My pH neutral shampoos, of course, again, the pH of scalp is around 4.5, 5.5, around that. So, something which is mild for the scalp always tends to help. One can use hair systems or wigs or patch, yes, because the loss, like we said, starts from 2 to 4 weeks. The recovery, the complete recovery may sometimes take up to 6 months. So, up until that time, if someone is having issues with going out or wants to feel more confident, then yes, they can use some hair system or patches, which are again not very tight on the scalp, which are easily removable. The gums or the clips that are being used should not be something which is causing more irritation to the scalp. So something which is temporary, we can wear whenever you are going out, and you can come back and you can take it off. I think that is always a better option than wearing something which is much more permanent in terms of hair or wigs. Then, of course, protecting the scalp from very too much of heat and cold, of course, is again very important. Too much out on the sun, not for too long hours, again, is very important. Of course, you can cover your head with a simple scarf, or use pillowcases which are satin and much more comfortable for you. Always helps. Sunscreens and head covers are again the same thing that you can use. So next. Yes. Once, what to do once the chemo is over? So typically, it will always depend on the number of sessions someone's need, and of course, the oncologist is the one who is going to decide and see how it is happening and how much it is helping you. The dosage of the drug, the number of cycles someone's need, and the frequency someone needs is typically the deciding factor most of the times. In terms of what would be the severity of the loss. With some drugs, of course, the severity is very much, and it can sometimes cause permanent alopecia also. I would say we should give around 6 months at least before really knowing whether or not this is a temporary alopecia or a permanent alopecia. And we should always speak to our oncologist and understand that if we are supposed to give a little bit more time in terms of what medications we have used, that can vary little bit with few drugs. So, patience again is, of course, the first thing we should all be. Typically, also, I would say anything for hair, any treatment for hair takes a lot of time to, give you certain kind of results, and you need to keep doing those things, whatever lifestyle choices, like, having a good diet, having a clean scalp, all these things are very, very important. So, you have to keep doing these things in order to maintain that good hair health. so I would say yes, we have to wait it out properly. In the interim, we should take care very well of our macronutrition for hair in particular. Of course, a good protein diet is of absolute importance. Good proteins are something that we should be taking. Healthy fats are important. Good veggies, good fruits, all these things are very important. In terms of micronutrition, I would not name any one mineral or vitamin. I would say everything is equally important. So maybe a multivitamin, which is almost everything, along with biotin, of course. So something like that. So after the medication, of course, slowly comes out of our body, slowly the recovery time also happens. But yes, like I said, it may take some time. So just eat well, keep your scalp clean, take some multivitamins. I think that should take care of almost 80-90% of the job. um, Now, again, here we talk a little bit more about the recovery. So, around 3 to 6 months after the chemotherapy ends is where we can start expecting hair growth. One thing which is important to understand is when the hair grows out, or whenever, even if not all of the hair falls out, we can see some changes in the texture, the pigmentation. If someone had very dark hair, the hair that comes out later, recovers, that can become a little bit lighter. Other thing is like the texture of it. It can sometimes become coarser, sometimes it can become much more softer and, kind of more malleable, I would say. These become more rampant if there was already a pre-existing nutritional deficiency, or some other disease that was already going on. If not, typically these things are less observed. But like I said, during the recovery time, if we are taking about good macros and micros, it tends to take care of our hair on the recovery much better. So hair loss during and after chemo cannot be prevented at all, which is very much true. It cannot be prevented completely. With few drugs, yes, maybe the intensity may be lesser, but almost with all drugs, there is some kind of hair loss that we tend to see. And of course, there is no role of growth serums and hair oil, which will completely prevent the loss to happen. So here we have a beautiful picture of Sonali Bendre, and she is a cancer survivor, and we can see all her hair has grown well. She had been very fit before that. We could see that with a lot of pictures pre her cancer diagnosis, and what we can definitely take away from that is definitely she had a very good diet. She really did take care of her macros and micros, so that's why her recovery looks beautiful in the pictures. Here, also one thing that we can have a look about is the regrowth after chemotherapy, how it typically happens. So you can see in the first 3 to 4 weeks, the hair is very soft and fuzzy. It is almost like baby hair, or lenigo hair is what we call them. Slowly, 4 to 6 weeks, it starts becoming little bit more thicker. 2 to 3 months, it becomes an inch longer. Another 3 to 6 months, 2 to 3 inches of hair length increases, and 4 to 6 inches of hair by 12 months. So we can see compared to normal hair growth of someone who has not undergone chemotherapy, the growth is little bit slower. But like I had already said before, anything with hair, it does take time. And once the chemotherapeutic drugs have come out of the body completely, it slowly starts getting better as well. Coming to role of medications, there are few medications, of course, which tends to help. um, Minoxidil orally can be taken. Topical minoxidil is also something that tends to help. But yes, all these things before starting, we should have a good discussion with your doctor. Also, we have few reports where you have seen that yes, it has helped. There are some prostaglandin substances also which tends to help. Few other injections, PRP, platelet-rich plasma therapy also tends to help. I would say that is definitely a safer alternative also. But yes, the response is again not as good. The way minoxidil works is it is a vasodilator. So basically, it dilates the vessel to wherever we are targeting it. So more dilated the vessels are, there is more influx of more nutrition and more oxygen coming towards the hair roots, and it basically propagates the hair roots to come out to the growth phase. So this way, all the hair roots which were had gone to the resting phase because of the chemotherapeutic agents will be propagated to come out to the growth phase. So that is something which is definitely helpful and can be sort of done more, I would say. Another thing which is used also, I think we can talk about it on the next slide. Minoxidil topical is another option, of course. Effectiveness of oral minoxidil is, of course, better than the topical minoxidil. It comes in the same percentage of 5 and 10%. It is a better alternative, the oral one. Topical is difficult because compliance becomes more difficult with patient doing the applications every day, and some may have some inflammation, redness, or itching also with the topical one. So oral, I think, is much better than the topical one. So in the next slide, there are a few things that we have seen which have helped. There are a few studies and papers about these things as well. One thing which keeps coming up again and again, even though it was basically started or found back way back in the 1970s, are the cold caps or the scalp cooling systems. I mean, the whole idea was based on that. So, what it essentially means is we are trying to work in two ways. So, if during the chemotherapeutic agent is being injected into the body, if the scalp is given cold temperature, the cold temperature, first of all, decreases the high metabolic activity or the high mitotic activity that we were speaking about when we were talking about the energen effluvium. That is one thing. Another thing is, of course, what it does because of the cold factor. What it essentially does is it shocks the hair, and the amount of pooling of the chemotherapeutic drugs becomes lesser. So that way the vasoconstriction happens and there is less pooling of the drugs into the root level of the hair follicles. So these two ways, of course, the hair fall or the hair shedding because of the chemotherapeutic agents can become lesser, and that way basically we can have an easier recovery, I would say. Does it completely prevent the hair fall or hair shedding? I would say in few drugs it has helped to a very great degree, but I would not say that it can completely stop it, even in a drug which is highly notorious for causing the alopecia. Other things that is again helpful that we have seen over the years is people suffering who had say chemotherapy for their cancer and now they're cancer free, but if they had a family history of say male pattern hair loss or androgenetic alopecia, those people have seen aggravation or aggravated loss, increased frequency of hair loss. So in such patients, of course, we should wait out the complete 6 months or maybe sometimes even 1 year for the hair to grow back as much as possible. Give them medications, the medications such as minoxidil and another medication which is finasteride, which is a DHT blocker for hair loss in men. Those medications, of course, after consulting with their primary oncologist. And once we feel the hair has recovered as much as possible from the chemotherapeutic agent, and the hair loss also, the male pattern hair loss has also stabilized to some degree, then of course doing a hair transplantation is a very very good idea, I would say. It really helps. We have done such a transplant for female patients also, where they had kind of different kind of hair loss, where the hair at the back was very good but the top hair was thinned out quite a bit, and after especially the chemotherapy session it had taken a big toll on her. So yes, we have seen good results with that, but I would say we will always have to wait out completely and see how much benefit we are having before addressing all these things. Next, I think next up is Jax. Jax is basically Jax Austin is a patient of ours from LA. So he also had cancer, and he's had suffered it, and a couple of years ago, around 5-10 years ago. And after coming out of his cancer, he had almost accepted the faith that gone, my hair is gone, and now nothing can fix it. He did have a history of male pattern hair loss in the family, but it hit him when he was very young, and it made him very very upset. And like I said, the chemotherapy basically made it worse. So after taking consultation with a lot of doctors, he had finally approached us, and because we could see the he was in complete remission, his hair at the back was looking nice and strong. He was taking healthy diet, healthy food, and everything was stabilized for some time. So we did have a hair transplantation for him. Next slide, I think we do have few pictures of him that we can see. So this was Jack's when he came in. If we can see, there were very very few hair, thin hair at the top, and after almost around 6,000 plus grafts, this is where he is now. It's a little less than a year, I would say, and this is definitely going to get much much better. So things like this are basically something which really makes us happy. Cancer in itself is a diagnosis which makes us very heavy at the heart. But whatever few things I think we can do in terms of making it a little bit easier for the patient, I think we should all again have such things to talk with each other and understand what is the best for our patients. That's it from my side. Thank you so much.
Dr. Priyadarshini, thank you so much for a very informative talk. We'll take in a few questions. Maybe I'll start with this. Is the effect of chemotherapy the same across all the patients and therapies? Which are the ones that have the highest rate, or which kind of patients do you actually see loss of hair due to chemotherapy?
So, no, sir, I think what I would like to say is, of course, we don't see too many patients right after the loss, but yes, after a couple of years. So, I would not be able to exactly tell you the drugs, but there are few drugs which are very notorious, which can cause permanent loss also. But most drugs, what essentially happens is the dosage, the frequency, and the number of cycles they have to do. Based on that, even a drug which say with just one cycle would not have caused hair loss or hair fall, or could have been prevented easily. If we are having to do multiple cycles with it, may cause more loss.
Thank you. Thank you. The other thing is, of course, the cooling of the scalp before the therapy. Do you think over the past few years it's actually picking up in terms of its practice? And how is the scenario of these devices being utilized in India?
So yes, in India, I think it is not fairly common, but of course, in the Western countries, it has become much more popular now, even though it has been there and it is USFDA approved. Actually, it is the only thing which is actually approved in the prevention part of the chemotherapy induced alopecia. But yes, there are a lot of reports which do suggest that with certain drugs it works like a miracle. With certain drugs, of course, it does not do very well. But like I said, a few things such as having the few prerequisites of good diet and the kind of what drugs are being used, all these things I think does make a difference and help the cooling caps systems as well.
No, no, thank you. Thank you very much. A couple of myths that we want you to help clear, right?
Sure.
Does shaving head during chemotherapy help hair to grow back faster?
That would be a myth. Yes.
And are there any special oils or shampoos that people can use to kind of prevent this?
Uh,
Is this
No, sir. No oils or serums can prevent this, at least. Whatever experience or data we have until now are very few in terms of, things to prevent it, but definitely not any oils or serum can help with that.
and also, of course, stress during cancer treatment, can it delay the hair recovery process?
This I would like to say maybe yes, because typically also we do see a lot of changes in hair cycles when it comes to stress. High stress individuals tend to lose suddenly a lot of hair, which is called as telogen effluvium. So the stress can be physical, mental, emotional, or nutritional also. So yes, if someone is very stressed, then recovery can of course become a little bit more difficult for some patients. Yes.
Thank you, ma'am. And in line with that particular question, hair loss is quite it does affect the confidence of the patient, right? What advice would you give to people struggling with this side effect of chemotherapy?
Mm, I think resilience, which they already have in them. Hair, we know, takes a lot of time, and yes, it is something that we value a lot. But the fact that they have undergone a chemotherapy and they're still there, that much is just already saying it that they are heroes. So I think just the hair should not cause a confidence issue in them at all. I know saying this is probably much easier than actually going through it, but I would say that my hats off to all those cancer survivors, doing cycles of chemo and coming out victorious and going through it all.
No, thank you, ma'am. That's a very powerful message that you've said, is that they are already heroes, and this is one aspect that they can definitely take over as well. How important the community and the family support in this process around our patients?
I think people who can have that support system in terms of family members and in terms of friends and community, I think they are really blessed, because it takes a toll not on the patient themselves, but also in everyone else in the family, and it's something that we should all share, talk about it, understand what each and everyone is feeling, and be really supportive of the patient and what they are going through. If someone does not have someone whom or does not have an immediate family they can speak out, there are a lot of support groups also which can make help you go through this much easily. So please, I would say, just please talk to someone. You are not alone in this. There are so many people who are suffering the same way that you are, and we there is always someone who is going to lend you a ear, I'm sure.
Thank you, ma'am. In all of your experience, are there some anecdotes that you would love to share about some very memorable experiences with patients who, of course, that you've treated have regained hair and also their identity and their confidence? Any very memorable patient experiences that you might share with us?
Yes, like we were just talking about Jax Austin. He is a very dear friend of us now, and when he came to us, or when he was in touch with us initially to think about or to explore the option of a hair transplant after losing most of his hair because of chemotherapy, and because he had pre-existing family history of male pattern hair loss. He was very skeptical. He was he wasn't sure because most of the doctors had, told him no, that no, it is not a possibility and it cannot be done. You don't have enough donor, or you will never reach from point A to point B hair wise. He's he's a YouTuber also. He travels from place to place also, so, and he keeps putting out videos, but he's to never, show his hair out. So when he had the initial consultation with us, and finally when he got the confidence, and from that time on till now, he has not stopped smiling. And the positivity that he radiates, it's just, I think, out of the world. And that's what we all need in our lives. I mean, you can see him. I mean, he is a survivor. He got out of it, and now he spreads smiles, does beautiful things, in and around India also. A lot of social service, all these things also he keeps on doing, which is just beautiful and amazing. And you get to learn so much from such people.
No, thank you, ma'am. That is just amazing, as you rightly said, that the exponential impact that you have with interventions that not just treat patients, but they touch their lives as well. Well, with regards to a couple of other questions, ma'am. So, how is the uh, effect of diet, right? I mean, are there any specific things in the diet that patients need to consider post chemotherapy for hair loss recovery?
I think general hair health again. Protein is very very essential, because protein is the main material how your hair shaft is going to be built. So if you have good protein in your diet and you can include enough in every meal, I think you have done most of it. We have done most of it. So I think good protein diet, and like I said, a multivitamin, of course, something would all your micros or all your vitamins and minerals, not just one thing which is biotin. That's not just enough. So we have to make sure that we are taking all the vitamins and minerals along with biotin, and having a very good protein diet.
Thank you, ma'am. Thank you, ma'am. Are there any specific hair care, I mean, routines that you might suggest for patients post chemotherapy? Is there anything out there that is scientifically validated, or are they mostly placebo therapies?
Post the chemotherapy.
Yes, ma'am. Yes. Any
Um,
specific routines? I mean, this is just general information for the public.
So, in terms of therapy, yes, platelet-rich plasma therapy tends to help to some degree. Again, I would not say that is that one thing which can make you go from point A to point B. It is not a miracle therapy that is going to, change everything. I would say a lot of things pre-chemo, during chemo, and post-chemo together basically makes it easier for the hair shedding to, be lesser, or the recovery to be easier, and your hair texture to be maintained, or the thickness to be maintained. So just not one therapy, but yes, platelet rich plasma therapy has helped a few patients, yes.
Thank you, ma'am. Should survivors also avoid any kind of specific procedures on the hair that is grown back, like, for example, coloring or any other treatments? Do you think that is not advisable?
um Again, I think that would largely again be something that we would normally or generally do for our hair also. So normally also something which is too much filled with chemicals, things which can have a lot of ammonia, PPDs, and formaldehyde, all these things which are typically present in lot of straightening substances, lot of dyes as well. All these things definitely should be avoided. Just if they at all have to color their hair, they can color it right only at the hair shaft, and not let the scalp or the root touch, so that there is minimum or negligible absorption. And the frequency of using colors or hair dye should be definitely much lesser. And yes, like I said, it should not touch your scalp as much as possible.
Thank you, ma'am. Thank you, ma'am. Uh, Great, ma'am. So my, uh, final question, right? If I may say, what message of hope would you like to share with cancer survivors for just beginning their healing journey?
Um, so I do understand that it is going to be a difficult journey, but you are here and you have people around. Science is has done enough, but of course, we science has a long way to go as well. But there are good treatments available, and don't be in despair. Believe in God, and just keep having faith in yourself that you will fight it and you will come out of it. There is going to be just better days forward. So please don't lose hope.
Thank you so much, madam, for your valuable time this evening. On behalf of the Grace Cancer Foundation, we'd like to
So
thank
much,
you.
so much.
And also, we'd like to remind our viewers that the 8th Combient Global Grace Cancer Run, powered by Evernorth, is going to be held on October 12th. So these are all the webinars in line for us to, in the run-up for our run to raise awareness for detection of cancer and early screening and healthy lifestyle. So thank you once again, ma'am, on behalf of our team for your time this evening and for joining us and for educating us about hair and healing. Thank you so much.
So much. Thank you so much for having me. Thank you.
Yes. Thank you, madam. Thank you.